The COVID-19 has just been designated a pandemic. Are you afraid? You should be, and let me tell you why. My name's JC. I'm usually talking about how to live in some place like Thailand where you can get more life for less money. Today it's a little different. I just want to show you how to get more life. This is really important, so I hope you follow me for just a few minutes while I explain some things to you. I used to tell people, don't be afraid. If you look at the numbers, they don't warrant the kind of fear that's going around. But I changed my mind, and let me tell you why. I think fear is actually a really good thing and necessary in this situation. I've flipped 180 on this. I need to tell you why. If you're afraid of dying because of this, that's one thing. If you're afraid of going to the shopping mall, that's another thing. But if you're afraid of, okay, I'm not going to be able to go to my sporting events and see my team play or go to the bar, like they've shut down Italy and shut down China, is that a good thing or a bad thing? I used to say, there's no cause for that. Look at the numbers. The flu is, more people are dying from that. But I changed my mind. You know why? Because I think fear is a good thing in this situation. Why would that be? Because it gets you to pay attention, it gets you to be careful, it gets you to break habits that might not be good in this situation. We can solve this issue. I need to tell you, I'm really disappointed in people. There's been people that have weaponized this virus to fulfill agendas, and I'm talking about political and financial and all other ways. This is not the time for this. They're causing divisiveness. There's no time for this. This is not the time. That's childish and irresponsible. Us people need to tell them to stop, whether it's a person, an organization, a news, a media organization, it doesn't matter. Tell them to stop. This is no time for that. This is time for unity and solidarity. We need to call them out on this. This is a time for us to come together and fight a common problem. This virus has no borders. It has no political affiliations. It has one purpose and one purpose only, and that is to replicate using us as the hosts. This is not a time for division or blame. There's something humanly wrong in that kind of behavior in a time like this. Now's the time to turn this virus around. The clock is ticking, and we have two choices. We can either wait for the government to do this, like they've done in Italy and China, trying to resolve the issue, or we can do it ourselves. But to do that, we have to come together and be a force for good. In this time and age, we don't celebrate admirable human values like we used to do when I was growing up. There were things that people would do that we would look up to them for doing. That's all gone out the window. Maybe this is why the virus manifested itself in this time and age. Look at the world. We've gone off the rails. Maybe this is a way for us to get back to what's important for human beings to survive. The universe of the world has always found a way to balance itself when things have gone astray. When things go to, the pendulum swings in one direction too far, something will happen to bring it back the other direction. I think this might be it, because we need this in so many ways to reset human behavior, financial situation in the world, all these things. This might be the catalyst to do that. So in some ways, this might be a positive thing. But let's talk about how to turn this around. It'll take unity of people to do this. If you look at the line of the new cases, it's climbing. It's not climbing as much as it was before because some of the cases in China have slowed down. But it is climbing. People of all nationalities, just to listen for a few minutes, because we can do this. And it isn't brain surgery. In a period of about 2 weeks, we could actually eradicate the virus, or at least radically slow down the amount of new cases happening. And without new cases, the virus will die off. Why 2 weeks? Because 2 weeks is the incubation time, the time from where a person becomes infected to the time they start to show any kinds of symptoms. So if we can do what I'm talking about for 2 weeks, this thing will change completely. And you're saying 2 weeks? Listen, human beings can do anything for 2 weeks. I have confidence in people that you can just do something very simple for 2 weeks. Now, might it be a little bit of a change in lifestyle of what you're used to? Yes, but 2 weeks. If you're not willing to save yourself or save your friends or save humanity by doing something different for 2 weeks, and it's not difficult. Like I said, this isn't brain surgery. So listen up. This is all we have to do as human beings. Come together. Let's do this. All we have to do is something for a very short period of time. Now, there'll be naysayers that are going to listen to what I say and start rah, 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 rah. That's fine. If they want to do that, that's up to them. The question is, do you, listening to this, want to be part of the solution or part of the problem? Because this virus infects exponentially. It'll start with one person. It'll then spread to a cluster and then to a community. If we stop it at one person, it doesn't grow any further. This is how we fix this as people. Governments can make you do this, but we can do it voluntarily and more efficiently. Keep in mind though, not everybody that gets exposed to the virus will even get symptoms. Some of the people that get exposed will develop some symptoms, but they'll get over them rapidly. And then there will be other people that will get symptoms and go on to be having more serious symptoms and need to be hospitalized. And some people might even die from this.
That's right. And that's not uniquely true for this novel coronavirus. There are other viruses for which some fraction of the illnesses end up being severe and even fatal. That's true particularly of flu, for instance. But in this case, there were novel pneumonias that weren't explained by existing organisms, either bacteria or viral, and then that led to the discovery of the novel coronavirus. Pneumonia would mean an infection of the lower part of the airway, what we call the lungs in medicine. But anything can cause that. So it can be a bacterial pneumonia, but it can be a viral pneumonia. And in the case of flu, one of the things that distinguishes flu and the coronavirus from things like the common cold is that it does settle down into the lower airways, into the lungs, and that's part of why it's so severe.
If you're afraid of all of those and you're not sure what's going to happen, all those are non-issues to a certain degree. And what I mean by that is all we have to do is do certain things, and then those issues will resolve themselves. Some people say, well, I'm healthy and everything else, I probably wouldn't develop symptoms. If you want to roll the dice, that's up to you. I'm not going to roll the dice, so I want to take the necessary action to protect myself, my family members, the people I love, and hopefully our community, and then our country, and it just expands from there. If each person just does that, if you just took care of yourself, that takes care of the people around you. And if each one of those people take care of each one of themselves, it takes care of the people around them. And you see, that's how this works. So the two things are the receiving and the transmission. Let's start with the receiving first. People become infected through respiratory droplets.
I'm with the World Health Organization, and I'm the technical lead for this novel coronavirus outbreak called COVID-19. And this is a really important question because there's many things that you can do as an individual to protect yourself and to protect your family against this novel coronavirus. The first thing is very simple. The first thing is to wash your hands regularly. And it sounds very simple, it doesn't sound very exciting, but it is incredibly important that you make sure that you wash your hands with soap and water, and make sure you get your kids to wash their hands as well. And if you don't have soap and water, you can use an alcohol-based rub. That's the first thing. The second thing that you can do is what we call as practicing respiratory etiquette. And what that means is when you sneeze or if you cough, that you do that in a folded elbow, and you sneeze or cough into your elbow, or you use a tissue, and then you throw that tissue away, and then you make sure you wash your hands.
We're still trying to work out how quickly and how easily it spreads. It's believed that it's spread by respiratory droplets. So that's going to be when you cough or you sneeze, respiratory droplets come out of your mouth and nose, and that can spread the virus. It's generally spread by prolonged close contact with somebody who has the disease. But hand hygiene, that is also critically important. So that would be either washing your hands with soap and water or using an alcohol-based hand rub. So that really is critically important, not just for coronavirus, but honestly, if you don't want to get the flu, if you don't want to get a cold, that is really your best method of protection. In terms of cleaning in your home, just a regular standard disinfectant is effective in killing the coronavirus. So if you are worried about surfaces in your home.
This is not an airborne virus like the measles, and some people might argue and say, but I heard. It's okay what you heard. The numbers don't prove that out. If it was airborne, look at the hospitals in China. Look at all the things that have happened so far. much more, exponentially more people would have been infected if it had been airborne. It's respiratory droplets. Now, are there aberrations to this? Yes, but those are aberrations. Take those out of the equation because we can't deal with every possible scenario. Let's look at the generalities of this. And you can go back to the WHO, WHO, and listen to what they say. And you can listen to epidemiologists and biologists that will actually tell you this. Now, are there some fear mongers out there that are also doctors that are saying something differently? Yes, but let's just address what we know about this and what's being recommended. The numbers so far at this point are lower than the actual flu during flu season. Let's keep it this way. So the first thing I want to talk about is how long does it last on surfaces? You're going to hear reports now, oh, it lasts for weeks and it's in the human feces. You're going to hear it's in everything and it's on everything and it's going to last forever. That's not the case.
It can also be spread by surfaces. We call those fomites in public health. And these are just inanimate objects that can hold onto that virus and can transmit from person to person. So think of a doorknob, for example, is a fomite. So in the hospital setting, we of course have our healthcare professionals wearing the appropriate protective equipment. We also have cleaning procedures in place. Fortunately, this virus is very easily killed on surfaces by common disinfectants. So we are able to clean surfaces and get rid of the viruses like that. We know for things like SARS and MERS, which are also in the coronavirus family, like I just mentioned, they can live for several days on surfaces, but it really is highly dependent on temperature and humidity. And so depending on the environmental factors, it may live for less time than that.
So there are some studies that are ongoing right now that look at virus survival. And so what that means is how long can you actually detect a live virus on a surface and for how long? And so these are some preliminary studies. We don't have the full results yet, but what we know from other coronaviruses like SARS and like MERS is that on packages, on certain like cardboard materials, that it doesn't last very long. And so it won't stay viable. It won't be alive. The virus won't be alive for a very long period of time. What is important, though, on certain other surfaces like plastic or like in healthcare facilities, that the virus can be inactivated or killed, if you will, by disinfectants. And so, as I'm sure everyone has seen, when you clean your house, you clean in healthcare facilities, it will inactivate.
It doesn't mean we can't stop this. It's very easy. Wash our hands. Wash anything that comes in contact with surfaces when you're out in public. When you're in the home or anything, it's not an issue. You don't have to worry about it. This is only when you go out in public. Carry hand sanitizer, soap, antimicrobial wet naps, whatever you need to do. And when you go to touch something, after you're through touching it, wipe your hands. You only need to do this how long? I didn't hear you. How long? 2 weeks.
What we call the incubation period, which is a big fancy word that basically means from the time that you are infected to the time that you develop symptoms. And 14 days is the upper end of the incubation period that we are following. We believe that most people will show symptoms after infection about 5 or 6 days after they are actually infected. And as of right now, we feel very firm and confident that 14 days is the right upper bound.
We'll watch the numbers. You might have to do it longer than that, but in your area, if there's no cases or anything, the chances of you getting it at that point is almost like winning the lottery. But until we know it's a non-issue, we need to follow these procedures. The best and only thing as far as receiving the virus is keeping your hands washed.
Again, I'm going to say again that you wash your hands regularly with soap and water and make sure that you wash thoroughly, or you use an alcohol-based rub. You make sure that you practice respiratory etiquette where you sneeze into your elbow or cough into a tissue and throw that away.
Now, you can also disinfect things around you even so before you touch them. And so if you go to sit down at a table or something, you can actually use a wet nap, an antimicrobial wet nap, or a spray like colloidal silver or a disinfectant, and wipe down the area. You're gonna, if you do that, you're limiting the amount of chances of you getting this exponentially. So it will almost be impossible for you to get it.
So you really want to use something that is effective against a type of virus called enveloped viruses. So these are viruses that have a lipid bilayer around them, and if you can disrupt that lipid bilayer, you can essentially kill the virus. So flu is one of those types of viruses, so I would recommend if your disinfectant says that it's effective against the flu, it should be effective against coronavirus as well, because flu is similar in structure to the coronavirus. I mean, really don't just say, oh, well, I sprayed my countertops with this disinfectant, so I'm fine. Really, hand hygiene is going to be your best course of action to prevent this coronavirus and really any other respiratory illness that you might be exposed to. Nobody wants to get the flu. Nobody even wants to get a cold. So really, your best bet is to wash your hands. When you walk in the door from work, when you bring your kids home from daycare, walk straight to your sink and wash your hands. That is really the best thing you can do. And really make sure that you're doing it properly as well. Follow CDC guidelines for the proper way to wash your hands.
It's interesting because you don't want to touch your face, because if you disinfect everything and you wash your hands, touching your face isn't an issue. But for some people, that's a habit, and we need to break the habit. And it's interesting because I was watching the news, and here's a person, a health official, that's telling people, you got to be careful. You can't touch your face. And she's licking her finger and turning the pages of the thing she's reading off of while she's saying it. It's crazy.
Today, start working on not touching your face, because one main way viruses spread is when you touch your own mouth, nose, or eyes. And of course, enhance cleaning of surfaces.
These are the power of habits. This is what I was talking about when I started this, about fear. It's really important to be fearful, because if you're fearful, you'll pay attention, you'll stop yourself before you do it and go, ooh, I shouldn't touch my face, I shouldn't touch my eyes, I shouldn't, because that's the thing, you don't want to touch your face. If your hands are infected with the virus, that's how you're going to get it. Because you can shake hands with somebody that has it, and that wouldn't be an issue if you washed your hands afterwards and didn't touch your face, and that they didn't cough on you, because again, it's respiratory droplets. Now that comes to the thing about wearing a mask. Some people wearing the mask, if they do it improperly, increase their chances of getting the virus. You don't want to do that. You want to decrease the chances of you getting the virus.
No, COVID-19 is not airborne. COVID-19 transmits via droplets, and what we mean are these small little particles of moisture, liquid. And these particles, when they come out of your mouth, they drop. And so that's why we say between 1 and 2 meters. Anything beyond that, and they don't disperse. When they come out of your mouth, they drop. And so that's why we say between 1 and 2 meters. Anything beyond that, and they don't disperse. So no, it's not airborne. We do tell healthcare workers that when they are treating patients, sometimes they have to do procedures on very sick patients where they have to intubate them. And sometimes you have particles that could be dispersed much further than just that 1 to 2 meters. And so in those situations, we tell healthcare workers, you have to use airborne precautions. And so there may be some confusion out there when we say airborne precautions. Those are for healthcare workers performing very specific procedures, but for every day, no. When we say airborne precautions, those are for healthcare workers performing very specific procedures, but for every day, no.
Masks haven't been shown to prevent spread among the general public of coronavirus. You can get it by, direct inhalation. It's not just touching things and touching your faces. But realistically, you need a prolonged close contact with someone who's coughing. So think if you're in the grocery store, if somebody is coughing, you're not just going to be standing right up there next to them. You're going to be moving away. So just passing someone in the grocery store, that is not prolonged close contact. Yeah.
And so, again, maybe the incremental benefit that a mask might have if in place at that particular moment, it seems to also be offset by the fact that these are technically difficult things to use correctly. And like any other safety device, say a seatbelt, if you don't buckle it correctly, it's not serving as a safety device. So the idea is if a mask is here, maybe it's blocking a droplet, but that droplet then is on the mask. And how you handle the mask and what you do with it is absolutely critical, how often you're changing it. So in a low-risk situation, then it's often offsetting any benefit from the mask. mask, and that's what's led to them not being recommended generally.
Yes, exactly. I mean, you see a lot of people, they'll pull them down right below their nose, or they'll even pull them down under their chin to talk to somebody or eat something and then pull them right back up. Well, I mean, like Dr. Bailey said, that droplet is on that mask, so now you're pulling it down right underneath your nose and mouth where you could just be breathing it in. In addition, now your hand is contaminated, and it can give people a false sense of security. Oh, I'm wearing my mask, now I don't need to wash my hands.
And one of the things that drives it as a concern is the quality and the nature of the exposure of a healthcare worker to a patient or to someone who might have this virus. The nature of that contact is often quite different than just the casual contact. So there's sometimes a sort of aura of hypocrisy. You're like, well, they're using these masks and they're using these devices and they're suggesting maybe we shouldn't use them. And the reality is that there's a very close contact to examine someone's throat, to examine someone's tonsils, to be around someone as you're examining, maybe even doing procedures where you're sampling the airway. These are things that generate an even higher exposure to the droplets that we've been talking about. So in those settings, we do, in all honesty, we use these respirator masks. But we do use them, but that doesn't necessarily generalize that level of risk is representative of what you would have out in the community. Oh, yeah. And actually, one more key detail that I would point out is that when we leave a room with a patient that's a high suspect, that equipment comes off.
Yeah.
So we're not walking the hallways of the hospital, among others, in this kind of a setting with this kind of equipment on. So this, again, just to address, I think sometimes that aura of hypocrisy, is understand exactly what we do with them. We're in there only when we're in a room, dealing with the patient. When we're back out amongst each other and still in a congregated setting in a hospital, we're not wearing this.
So if you're not in close contact with somebody that has the virus, that is coughing, the mask will do you no good. Again, it's not airborne. So keep that in mind. If you feel more comfortable wearing the mask, go to the WHO website and read up and pay attention to exactly how to do that properly so you don't increase the chances of you getting the virus. Because you have to dispose of it properly, you have to take it off properly, you can't reuse them, okay? But all you really need to do, be necessary, is be cognizant and be careful and clean the surfaces around you, keep them clean, clean your hands. That's to keep from getting it. And if you're saying, well, I'm not that worried about this thing, well, that's great. But keep in mind, you're rolling the dice, because if you came in contact with it, if your immune system is compromised, and you might not even know that, you might feel great and everything. How many people you know have felt great and then all of a sudden they go to the doctor and the doctor tells them they have something wrong with them? You don't know, and it's rolling the dice. So the best thing to do is be proactive. Because like I said, you don't know for sure that you're not immune compromised. Also keep in mind, if you got it, even though you're not immune compromised, maybe you'll develop slight symptoms. And if that's the case, you could pass it on to somebody else, and we'll talk about that just in a second. But just because you're not compromised, it doesn't mean you're not going to infect somebody else that is compromised. And it might not even be them. It could be another person removed from them. And if they die, you gave it to that person who gave it to them. So we want to take all this out of the equation. So you need to wash your hands, wash surfaces around you, disinfect them. You can do it with bleach, because some people can't find hand cleaners now. You can mix up a solution, a cleaning solution, to clean your hands or clean surfaces around you. This is really important. Keep in mind, age is a factor. Most people that watch my videos about retirement are older. This is an issue. So even though you feel strong and everything, age does play a role in this. So if you're over a certain age, it's even more important that you do and follow what I'm talking about. Now, I want you to be a hero. If you can save one life by not infecting somebody else, who infects somebody else, who ends up dying from this, you're a hero. You saved a life. Anytime you can avoid transmitting this and getting it yourself first, and more importantly, you become a hero. This is a time for us to step up, do the right thing, and be a hero. How often in your life do you have this opportunity to do this? Now's the time. And you can help save maybe millions of people. It takes one person at a time. Now, having said all that, let's get to the transmission part of this. If you develop any symptoms, and I'm talking about the symptoms of a flu or a cold or anything, it's time to take precautions, because the idea is not only not to get it, but if nobody transmits it to other people, it dies off. So to do that and to be aware of that is being aware of how you feel. If you develop the sniffles, If you develop a runny nose, not that many people get a runny nose though. If you get the symptoms of the flu, like ache or a fever or things like that, immediately start putting on a mask and think about self-quarantining yourself. Again, how long? 2 weeks. If you can only do it for a few days, you'll know in a few days. Again, 5 days is usually the incubation period. In 5 days, you'll know if you got better or worse. If you develop further symptoms, then you need to take action for that. Then it's really even more important to isolate yourself and keep things clean around you so other people don't get infected, and definitely wear a mask. Preferably stay indoors. It's time to read books, watch movies.
This goes to what's new and what's not new about the new virus. The fact that it's a respiratory virus, the fact that we've had a lot of experience with encountering patients with these symptoms has led to well-established ways to examine and evaluate symptoms. What we're looking for are the characteristic symptoms of the virus, and those have tended to be fever, is a very common feature of it. A cough, which tends to be dry, also fatigue, aches. In a few cases, maybe about 10%, there's also been gastrointestinal symptoms, diarrhea, upset stomach. So we ask about those symptoms. We would also ask about relevant exposure. Have you been around someone who's sick? Just to kind of get the idea if this is somewhere that we should be suspicious. Does it have the symptoms that fit? Those symptoms are not unique to the coronavirus. But once you're in that ballpark, once you're thinking this is something that could be corona, testing has developed. And this is one of the real advances between this outbreak and the SARS outbreak in 2003, is that we've been able to identify the virus much sooner and really roll out diagnostic tests. Now, could they be rolled out faster? Yes and no. I mean, they've been rolled out at various speeds in different countries. And at this point, not only does the CDC have it, not only do state public healths have it, but also private laboratories have it and have been able to make it available. And that's been changing from week to week. Everyone is a little bit different in terms of the constitution of their immune system and in terms of the vulnerability of their various parts, their various organs. And one of the things that we've learned is that when we look at who's dying from coronavirus, it's not evenly distributed. There are certainly identifiable high-risk groups. Age is one of the most important variables here. In folks who are 80 years and older, we see a much higher death rate among the cases. Even if you're 70 to 80, not quite as high as above 80, but you still see a higher death rate than someone who's under 50. And then children themselves seem to be the most mildly hit by it. You know, we do see flu deaths among children, but we see much milder versions of coronavirus among children. So age is one part. And then chronic disease is another variable that we've found, that people who go into the infection with chronic heart disease or chronic lung disease, so-called COPD or asthma, or maybe they have cancer, or maybe they have diabetes. Any one of those groups has a much greater risk of death from the infection than the general population.
If you're around coworkers and you feel that way, you definitely don't want to infect them. If you're around a coworker you see that doesn't look like they're feeling good, tell them to go home. Give them a mask, send them home. And if they start talking about, well, I can't afford not to work, ask them, how much will it be, especially in America? How much will it be if you have to go to the hospital or the doctor? It's better to go home now. Because if you end up in the medical system in America, it's going to be costly. Go home. Take care of the symptoms, because that's what they'll do in the hospital until it actually gets advanced or serious. They're going to hydrate you. They're going to give you painkillers to keep the aches and fever down. Hydrate yourself. Take electrolytes. Rest. All these things. You can get over this if you have a strong immune system. It's not a big issue. If your immune system's compromised in some way, then it could get worse. And then there's other things that are going on now that might make that better, but we won't talk about those here. But there are things you might be able to do to actually help solve this if you get it.
Well, the first part is to remind ourselves that, in fact, like the flu, most of these cases, the very vast majority of them are mild. And so if the symptoms remain mild, then that's where you're headed. That's where things are headed. And so and again, we haven't talked about this yet. We talked about the fact that there's no vaccine. There's actually no treatment for it in the sense of a medication that cures the virus.
Right.
So accessing a healthcare system, getting into your car right away at the first onset of mild symptoms to say, well, I've got to get a treatment for this. There's no treatment to be had. And in fact, in most cases, no treatment would be needed even if there was one. Mm-hmm. So realizing there's no benefit to going out with mild symptoms is the first, I think, mental check. If you start to develop symptoms that are, this is worse from day to day, and the real symptoms that are concerning are the development of shortness of breath, difficulty breathing. That starts to suggest that you may be tracking in the direction of a more severe one, and contacting your healthcare provider would be the first step, your primary care doctor. There's two elements of concern. The concern is do I have the coronavirus?
Yeah.
And there's a secondary concern is, even if I have it, is this anything of medical severity or concern?
Right.
So you don't want to spread the non-coronaviruses either. So if you've got a respiratory illness, you've got fevers or aches or a dry cough, these are the kind of things that should lead you to withdraw somewhat anyway. We call social distancing. And use your elbow to cough, be mindful, use what we call respiratory hygiene. But they're not the things, again, that require access to a healthcare provider.
You really don't want to just go rushing into the ER for just, a cold. A good rule of thumb to use is, would I go to the ER for this if there was no coronavirus outbreak going on right now? If the answer is yes, if you require immediate medical care, you are having an actual medical emergency, then absolutely you need to go to the ER. If the answer is no, if you never would have even thought to go to the ER for the level of illness that you have, then you want to stay at home. You isolate yourself from your family members. If you are feeling okay and you're okay to take care of yourself, you don't need anyone providing care for you. Go into your bedroom, shut the door, and give your primary care provider a call. Call them first, and they can often advise you on the phone as to whether or not you even need to come in based on your symptoms.
Also, if you're at work and you have a coworker and the coworker saying, I can't afford to go home, do yourself a favor. Do everybody a favor. Again, be a hero. Pool some money together in the office or wherever you work and say, listen, so-and-so's not feeling good. We want to send him home for the day. Can we all put $5 in to offset what he's going to lose in pay or wages? Again, step up. Do the right thing. Be a hero. Get that person home. Tell them to order pizza or whatever. This is an opportunity for them to be able to do things that they normally wouldn't do. Take some time off. Relax. Enjoy themselves, because they really need the downtime to get healthy and to not infect people, which is the most important thing. If they're home by themselves, they're not infecting anybody else. If they live with other people, they need to be aware of that. They need to wear a mask inside the house at all times. Again, go to the WHO website, learn how to take it off, dispose of it properly, and keep everything clean around them so they don't give it to other people where in the area that they live. If they develop a shortness of breath or a dry cough, then it's time to take the next step and go to a hospital. Get isolated and get treatment. This is really important. This could save somebody's life. If they wait too long, then it's going to be harder to recover. There are a lot of people that do recover even if they get serious complications. So don't think, if they get the shortness of breath or a cough, they're doomed. That's not the case. Many people survive and get well and recover from this and go on and go back out into society, and it's a great story to tell your kids or grandkids. And that's it. As soon as people stop putting themselves at risk or risking other people, it's a done deal. The virus is done, and we need people to be responsible and take this action now. And if you're thinking, no, this is different, they're saying on the news, and I see these YouTube videos, trust me, I've been around long enough to see SARS and MERS and all these things. There's been things in my lifetime, Ebola, that they said, it's going to decimate the population of the world, and it didn't happen. So we can stop this. Don't think it's all doom and gloom and this is doomsday, the end of the world. It isn't. All we need is to come together as human beings and do the right thing. And you might be saying, well, there's people that don't live in around where they're going to eat. They might not see this video and they might live up. It doesn't matter. Those stragglers are not issues for the most part. Why do you think a lot of countries don't even have cases of this virus? It's because those people are poor. There's no people traveling out except in their community, and people aren't traveling around. They don't have the money to go vacation in other countries and come back to those poor areas. They're actually better off than the people that have money. The people that have money go jet-setting around different places, end up getting it and coming back and then going to the clubs and dancing and everything and infecting other people. So if you're even in an area that you're saying, well, it's not an issue now, don't make it an issue. Stop it now. Like where I'm at, there's nobody around here that's got it. But I'm still going to do the right thing because you never know. Just everybody does the right thing there, it won't become an issue. Again, it goes from a person to a cluster to a community. So if everybody does the right thing till this is passed, you can go back to your normal life then. But for right now, let's do the right thing. If you have an ego, put it away. Now's the time to stick it in your back pocket. Don't think that you're Superman. Don't think you're immune from this. Just do the right thing. It's only 2 weeks. Put your ego aside. Do the right thing. Only 2 weeks. And I want to watch the line go down on the new cases. We can turn this thing around and turn off the news, turn off all the bad reports, because if you watch too many of those, you probably want to kill yourself from something other than the virus. You know, you'll feel so bad, you'll say, killing myself would be better than getting the virus. No. Look at the actual numbers, and then look at how many people have died during flu season in the United States since October, just of the flu, or worldwide since the beginning of the year from the flu. This is still recoverable. This is still doable. It's not that bad yet. But because people aren't taking action and doing it themselves, places like Italy and places like Iran and stuff are being affected disproportionately to other countries. So even if it's not where you are now, keep it that way. Now what I want you to do, please, take this video, copy it, share it. Give me different languages that I can put the caption in different languages. If everybody started this today, just did what I said, it's very simple, did it today, within 2 weeks, we can watch the curve of the new cases, the line turn around and start decreasing. It's doable, it's easy to do. So just keep that in mind. We can do this. We can all be a force for good. Be part of the solution, not part of the problem. Step up. You can become a hero today just by not infecting anybody else. You're being a hero, you're saving lives just by taking care of yourself and making sure you don't get it. That's easy, right? You can do this. We can do this. If we all act together, we can all watch together as the number of new cases dwindle, and we can do this quickly. I have faith in you. Be well.